Hey everyone, happy Tuesday. I cannot believe that we are already halfway into June, and today I have a very special guest that is going to be joining me. So we're going to give her a little bit to hop on, but I'm not sure if everybody knew this, but June is Acne Awareness Month. Okay, she is ready. Great. Hi.
Hi, Cristina.
How are you?
Good, good. Thanks for having me today.
Yes, you're so welcome. So I have Vanessa, who is so nice and thoughtful to come on here with us today and talk to us about some of their amazing acne products. I actually was just saying that June is Acne Awareness Month. So what better way, and to kind of mention to our followers that we are really kicking off our virtual consultations, and a lot of people are asking us about skincare. So what better way than to use June as, for Acne Awareness Month and kind of get to talk to our followers about the amazing products that you guys offer.
Yes, thank you so much again for having me today. Yes, and we as a company have been also promoting acne June as that Acne Month awareness, and we're here to provide information about different products that I suffer from acne myself that you can incorporate in your daily routine. Also, depending on the procedures they're doing with you guys,
Right.
um, we can definitely recommend some products to help diminish the acne.
Great, great. So, I think a lot of people think that acne is just like a teenage thing. And, I also have suffered from acne from time. And it's not for teenagers. It's not just for for young kids. It's actually, something that can be tied into or carried into our adult years. Um,
Absolutely.
and, a lot of it, some people think, could it be diet related? Some people think, could it be related to, um, you know, environmental factors. It really, to me, it could be. But a lot of people also have tried a lot of products, right? So they've gone to their dermatologist, they've tried insurance-based products, things that were sent to the pharmacy that may or may not have helped them. So, what I love to do is be able to customize or create something for somebody who honestly hasn't tried everything, who's honestly looking to have a solution to their problem, especially if they've tried things in the other thing too, that especially right now with what's going on, a lot of people may not have insurance.
Sure.
So here's a way for people to try our products, in this case, what we're going to talk about today, and have an opportunity to not have to worry about, if it's going to get covered or not by their insurance, or if they don't have insurance, have to worry about not having something to use.
Yeah, and that's a great point you brought up because we are medical grade. So definitely our ingredients are more potent, not as a prescription, but definitely to help them get through that, a combination of both, or, sometimes they don't even need prescription products to be able to manage their acne. Because I've heard that also from another PA of mine that she says she loves our blemish and age and our acne kit, and that's what really pretty much help her and just get clearer skin.
Yeah.
So definitely our products and the products that you carry in the office are a great combination for those kind of patients.
So let's talk about what we do carry. I know you have the acne system right there, and I actually,
Yes, we have it right here. This is a great kit. You know what I find also with acne patients is that simple steps do the work,
yeah, of
So
course.
keeping it simple with like a cleanser, a toner, and the blemish and age, which can be used either a spot treatment or could be used full face or both, you
Yeah.
know?
I love this kit because let me show everybody what you get. It's a
Yes.
little cheat sheet, right? So it tells you what to do in the morning, it tells you what to do at night. So again, simple is best. And you're getting here look at how big this cleanser is, right?
It's
This
huge.
cleanser. And could you use this on multiple areas, not your
Yeah. Yes, definitely. I've got another account that one of the coordinators likes to use it on her back.
Yeah.
Mhm.
Another issue is a lot of people will ask, well, what about a toner? So it comes with a toner, all right, and it has a little. It says for problematic skin, but a great thing about the toner is that it's going to cause, or it's going to, I should say, decongest the skin, right? It's going to help remove like surface debris and oil and dirt. So this is the actual size of the products that come in this kit. But really the powerhouse of this is the agent defense, the actual treatment, right?
Serum. Correct. So yeah, cleanser, toner, great to balance the pH, to clean the dirt, the oil, so the serum can penetrate even better.
Right.
So our version is lipohydroxy acid, so it's salicylic. And our blemish and age is what really controls the production of sebum, the oilness. It also has salicylic and glycolic, so it's also a little bit of anti-aging, if you will.
Oh wow.
Mm-hmm.
Trying to get it out of packaging, but it's going to be
It,
difficult.
yeah, it's a little difficult because it comes the dropper is separate. Mm-hmm.
This is the serum that she's talking about right here. And you guys might have heard some key terms with acne. Salicylic acid, glycolic, are all things that we in dermatology look for. We're looking for an acne-based regimen. So, and you mentioned that these products are medical grade. So I think that's important too, because, we want to make sure that we're spending money on products that are going to deliver and that are going to work. One of the things that I always found difficult was when patients would come to see me when I was doing solely medical, 2 days a week, and then my cosmetics 2 days a week now that we're just doing cosmetic. But, one of the things that they would say was that, oh, I'm using something from Sephora or Ulta. And, the problem is that we can't guarantee that that's medical grade and that's actually going to show you results. Now, one question that a lot of people may be having is this going to cause dryness? Am I going to have irritation?
Yeah, well, that will lead us to, it all depends on the kind of acne that they have. They may or they may not, but I do recommend they buy a lightweight moisturizer like our hydrating B5 gel,
Yeah.
which is hyaluronic acid and vitamin B5. It's oil free and it's a great addition to the regimen. So even for those patients that might be taking, yeah, or a prescription and that might get a little drier, this is a really good moisturizer that they can integrate in their regimen.
Wow, it's funny. So it's a hydration or has concentrated hyaluronic acid and vitamin B5. Some people
Mhm.
don't know that vitamin B5 is ultra hydrating, and it comes in a gel. So it's not a serum, it's not a lotion, it's not a cream, it's a hydrating gel. And it's great to pair it with your acne kit because people need cleanser, toner. Then a lot of people use the serum that we showed as a spot treatment. They also use it, as an all over the face or back treatment. Test if they have like diffuse acne. So that's like you said, depends on their grade of acne and how severe or mild it is. And then the last, you would want to pair it with this. I love this actually. I do love this combination. And you saw how big the size is. I mean, I would say that this could
Full
last
size.
for 4 months.
Yes, absolutely. Yeah,
I
the size is full size. Also, and this also happened to me because I'm an acne patient that usually you want to dry your skin, but it gets dehydrated for, all the alcohol that you apply or extra exfoliation. Sometimes we feel like we're so oily that we want to continue exfoliating, but we definitely need to add the hydration for our skin and add that, give a little bit of a break, if you will, on the production of oil.
Yeah, sometimes it's not great to strip your body of natural
Mhm.
oils, so less is more with some time with products. You don't need to have a ton of stuff that's going to dry your skin out because then you can create more of a dermatitis, which is another skin condition, more irritation. So, that's why I really do find that patients are looking for a solution to their acne. Maybe they've tried over-the-counter medications. Maybe they've tried products from their dermatologist. They've had to spend hundreds of dollars on products that may not have helped them or has caused them a lot of irritation. This is for somebody that is looking for a very simple regimen that is suffering. They have one pimple or they have several acne blemishes face, chest, or back. And it's for somebody who maybe has insurance, maybe doesn't have insurance. It's really just for the person who is looking to try something that they can use for about 4 months. That's a simple, quick regimen that's going to clear up their medical grade products.
Correct. And you can be adding more to the regimen also as you continue doing treatments or as your skin continues to evolve. The other serum that we recommend for acne patients is our phytocorrective gel. And the
Nice.
reason why is because it has a little bit of hyaluronic acid. It has thyme and cucumber, so it's very soothing, very calming, helps with the redness, helps with the sensitivity, and it also is an anti-inflammatory.
Wow.
So all of those, when you have acne active, active acne, it really does help calm down the skin a little bit. So, you've got options. It all depends on that kind of acne patient we're talking about. But that's great because they come to see you and then you can put them in the correct regimen.
Right. I love that because, a lot of people do complain of redness. And so that's great to know that the phytocorrective that we have the gel too, that can help. I love the mask. I have the phytocorrective mask too. Yes. I really love this. It's great for calming and soothing, maybe like once a week, kind of just to really calm down the skin if it's a little red. Even if you do get a little dry from some of your acne regimens or skincare, regimens, it's a great addition to use, and everybody loves a face mask.
Yes. Another mask that we have for our acne patients is our clarifying clay mask. So this mask is going to do is going to help you with the blemishes that you can do maybe once a week. Just a light layer, it's a clay, as it says. So it's very popular also in the treatment room when the estheticians are going to do some extractions. So it really helps soften the skin.
I love it. I think that the benefit to a clarifying mask is that it kind of draws out some of the impurities, right, without being over drying. Everybody loves a good face mask. Like I use this and I use it like every so often. I don't use it all the time, but I do use it, and I love it. Makes my skin feel afterwards. And it says like it's a deep pore cleanser, deep pore mask. It's honestly like an earthy clay, and it has like acids in there. It lifts impurities, gets rid of dirt and oils, will reduce your blemish if you have one. Like I actually have one right here. It's probably from chocolate or something that but I love it. And I think that people I would pair, even if you want a great moisturizer, like I would pair the Hydrating B with the mask. Or if you have a lot of redness, if you have a lot of inflammation on your face, I would phytocorrective gel with the phytocorrective mask. I mean, these are all great, even if you suffer from 1 or 2 breakouts. And that's why we do the virtual consultations, right? So the virtual consultations that we're offering, they're $75. You don't have to leave your house. You don't have to, come into an office just to be told, yes, you have acne. Like, that you have acne, that's why you're kind of searching for solution. So what we do during the virtual consultations is patients are calling the office to schedule it, get on my schedule. And then what we do is set up a time that we do a Zoom call, and patients are kind of telling me what their concerns are, what they tried, what they haven't tried. They're telling me, what's worked for them in the past, what hasn't worked for them in the past. And then a lot of times we're pairing them with one of these treatments, the Acne Kit. Maybe they need, a mask, whatever it is, but we're really tailoring specifically to their acne concerns and their acne needs. So I absolutely love it, and I love your products. I think they're fantastic.
Thank you. And I think that's great that you guys are continuing doing, seeing patients in the office, and also giving the other option of being a virtual consultation, because people are still a little afraid to go to the offices. And it's also, it's a good choice to have, sometimes you don't have to really be face-to-face. So it's good that you're offering that solution for your patients, and you can customize their treatment, because that's what the beauty is, honestly. And the same thing comes when we talk about the clay mask, for instance. You can mix it up with a little bit of the blemish and age, maybe make it a little lighter, and for kind of like same thing, to clean the pores and remove the impurity. You can mix it also with the retexturing activator. That's another serum that we haven't touched about yet. It actually looks just like the Hydrating B5 gel. Is a clear serum. And what it does, it has kombucha, and it's
Oh,
it's an amazing product that helps with cell turnover, but also it's hydration. So it does both, and those are for your patients that perhaps cannot do retinols or something more aggressive at night, because acne patients, we know they can be on retinol. Oh, everybody could be on retinols. So
yeah,
if you've got patients that are more on the sensitive side, you also carry a retection activator.
I love that. So, what about if somebody wanted to, and that's safe to use in pregnancy, right?
The retection activator, yes.
Yes. Okay. To throw that out there. But so let's talk about the kit, right? So the kit,
Mhm.
$135 for these three products here. Okay. And then I know that if you wanted to pair up the hydrating B, and this is definitely part of our regimen, this is something that I would certainly pair together. The hydrating B is like $83, I believe. So
Mhm.
honestly, for less you would spend for a really, really expensive topical, if insurance didn't cover it from a dermatologist, you're getting 4 products, which is
Yes.
unbelievable. And you saw how big the size was. They're going to last you well over 4 months. So I think that, one of the things I just want to drive home is if you're suffering from acne, is a solution. There's no need for you to walk around with acne. 2020, there's cutting edge products, there's cutting edge everything. Like, you don't need to walk around with acne. And especially right now, if you're not comfortable going to the office setting, we are offering virtual consultations for $75. That gets you access to talk about what you've tried, what you haven't, what issues you have, what you're trying to accomplish. And then, get shipped directly to the patient's house.
That's great. And also, pre-treating the skin is something that, when you're having your virtual consultations, maybe you want to pre-treat the skin with some products, and then patients can come in to do Vivace,
Yeah.
to do any of the great technology that you offer for acne scarring, and,
Yeah.
all the other treatments that could really pair well with the product. So definitely having a virtual consultation and pre-treating the skin, that's going to be for better outcomes for the patients.
Of course. Yeah. So a lot of people suffer from acne scars too. And although a lot of topicals won't help with acne scarring, it does kind of set the stage, if you will, to get your skin ready for treatments in the future. So, whether it's Vivace or other laser device gets your skin prepped for that. So I really do appreciate you chatting with us and coming on here. We love the support. Thank you so much for always supporting
Thank
us in
you.
the practice. Once again, guys, we have a Myrid spoke about, the Acne Kit, spoke about pairing that with the hydrating B gel so that you don't have to worry about dryness. We even spoke about 2 of our really amazing clay mask, and then a mask to help inflammation, pairing that with other serum. So we do have something to offer. Like I said, there's no walk around with acne. Maybe you're watching this and like you have a friend that's been looking for a virtual consultation, or maybe you have a child, a teenager, a 20-something-year-old that you live with at home that has acne and has tried everything. Reach out to us and let's schedule something, and we can talk to you about how you can get your hands on this. And also, I think it's great to mention, you can also, if you see this and you're like, oh, I've tried that before, but I want to try it and really don't want to have the application, you could still contact us and we can still get that out to you. But we are recommending, we want to make sure that you have the right products for your skin.
Absolutely. Yeah. So I do have 19-year-old daughter who does also use our LHA cleanser. And from time
Wow.
to time, she uses the toner. She says, she's like, I love it, Mom. My skin is so clean every time I use the toner. And she likes to wear a lot of makeup. So, you've got that. Definitely, acne is not for teenagers, like you said, adult acne, hormonal acne, the jawline. So definitely the products are suitable for every type of patients that is battling with acne.
Love that. It's so true. So true. Like I said, I suffer from it also, and it's not just for the teenager anymore. So we have solutions. I just want to say, like I said, thank you again for joining.
Thank you.
helpful for everybody. Have any questions, feel free to reach out to us. And if not, you again, and we'll see you soon, hopefully.
Yes, we'll see you soon. Thank you.
Bye.
Bye.